Hi, my name is Justin Steer. I'm a licensed occupational therapist with advanced practice in upper extremity therapy, wound care, and ergonomics. The majority of my clinical practice has been working with patients in the acute and chronic stages of neurological recovery and upper extremity orthopedic rehab. During my years of practice, I realized that a static upper extremity support, while beneficial for positioning and joint protection, do little to contribute to the neurological recovery of upper extremities following a neurological insult such as a brain injury or stroke. I realize that dynamic support option is critical if we as clinicians are to maximize on the principles of neural remapping and recovery. So based on the guiding principles of established stroke recovery interventions, I created the DUET. That stands for the Dynamic Upper Extremity Trough. This product takes into account the importance of upper extremity support for the joint, but combines it with the benefits of supportive movement at both the shoulder and elbow, both passively and actively. This trough connects directly to most standard wheelchairs, either right or left side, and can accommodate several types of wrist or hand supports depending on the need, such as a flat palm or a grip.
Notice as the wheelchair is propelled either by another person, such as a caregiver or a therapist, or even the patient self-propelling using the lower extremities, that the affected arm is supported while also engaging the shoulder and elbow in a flexion-extension pattern. This simulates active propulsion and promotes functional reaching patterns. The DUET allows for passive upper extremity movement as the patient propels the wheelchair, or active assisted movement depending upon their return of function in the affected extremity. The range of available movement is adjustable for most arm lengths.
So what we have is a wheelchair armrest, continuous passive motion mechanism. So the armrest is fully adjustable, either height or length, for any kind of standard wheelchair. We actually have the mechanism itself, which consists of the push-room crossbar, which has different positions to allow for different horizontal movement. We have the push rod that dictates how much incline or decline you get in the slope, and a track that you can't see here very well, but there's actually a roller mechanism which glides inside there. So together, this creates the motion you saw in the example outside.
When properly positioned, this ability to incorporate highly repetitive movement in the affected upper extremity during the acute and chronic stages of neurological recovery are significant for maintaining joint and soft tissue mobility, pain and edema management, and assist in DVT prevention while providing proprioceptive input for neural rehabilitation. These benefits extend to orthopedic considerations including frozen shoulder or joint arthroplasty. As a hand therapist, I quickly realized the benefits of having a wheelchair-mounted CPM for upper extremity use. Current CPMs in the market tend to be bulky and difficult to maneuver, and this often results in patients only utilizing an upper extremity CPM for short amount of time while in therapy, or they're limited to bedside or tableside use. This is a significant limitation when working with patients with orthopedic upper extremity injuries who might otherwise benefit from ongoing passive movement as a component of their rehabilitation. As such, the DUET has an option for a CPM controlled by an actuator or belt-driven embodiments. This allows patients who may benefit from the DUET to receive graded continuous passive motion as appropriate to the injury while seated in a wheelchair. This option is ideal for our growing geriatric population as well as the acute polytrauma population.